Hi everyone, welcome back to my channel. My name is McKenna and today we're going to have a very casual conversation about taking care of the elderly. Now, I'm not a physician, I am not a nurse, but I do have a great deal of experience in caring for elderly patients. I have been working at the bedside for 12 plus years. I started off in home care. I then went on to work in a long-term care facility. I then moved on to working with patients with dementia. I then went on to work in a hospital with acute care surgical patients. And then I worked in an emergency department as an ED technician. I have a wide variety of experiences working with many disease processes and lots of different age groups. And so for that reason, I think I can offer you some tips and tricks on how to better care for your aging family members, neighbors, and friends. If that sounds like something you could benefit from, stick with me in this video. And if not, check out one of my other videos. I'm sure you will find something that piques your interest. So to get started, we'll talk about activities of daily living, or better known as ADLs. ADLs are something that we talk a lot about in CNA school. These include activities like getting ready in the morning, getting dressed, brushing your teeth, going to the bathroom, preparing a meal. All of the things that we do every single day when we get up in the morning, throughout the day, and getting ready for bed. The biggest, most important tip that I can give you is that if you are caring for somebody who is aging, give them as much autonomy as possible. So what I mean by this is allow them to have control of what is happening and when it is happening. Work in their timeline, in their time frame. This is really easy to say as somebody who is not caring for an elderly parent currently. If you are somebody who has a full-time job and you're going over to somebody's home to take care of them before you head off to your full-time job, this can be a really difficult thing, but try to find some middle ground. They, after all, are in control of their body, and as long as it is safe for them and safe for you, they should be in control of what is happening. If this person is unable to get a shower on their own, but they are able to cleanly get themselves prepared for the day by just getting a sink bath, prepare all of the resources that they're going to need and allow them to do as much as possible. So this might look like you preparing a sink in the bathroom for them by getting the toothbrush and toothpaste ready, getting the deodorant ready, setting out a washcloth, setting out soap, turning the warm water on, letting it get warm, saying, hey, come on into the bathroom, I got everything ready, I think you're gonna be good to go. I'm gonna go downstairs and get breakfast ready if you wanna go ahead and get yourself ready for the day. This gives them autonomy, privacy, the ability to decide what to do first. Do they brush their teeth first? Do they put deodorant on first? What is it that they wanna do first? And I know this sounds silly, trivial, but to somebody who is getting older and who has very little control over their life, this is something that can really boost their confidence, boost their morale, and really increase and better their quality of life. You're probably familiar with this. This is a pill box. You can get it at any drugstore like a CVS, a Walgreens, a Rite Aid, and it runs from Sunday through Saturday. Put all of the medication in here and it organizes things so that person doesn't need to go through multiple pill bottles. Now, the issue with this is it's very easy for older individuals to confuse these. Sunday or Sunday, Tuesday or Tuesday, which one's Thursday? It can be very confusing. So, the easiest thing you can do is color code this. We'll run like the rainbow Sunday through Saturday, so you can do red, orange, yellow, green, blue, purple, brown, and that way everybody's on the same page. So if you're running late in the morning or the evening and they have medications that they have to take at a very specific time, you can call them and say, hey, I'm running late, but make sure you take your medicine in the green box. Make sure you take your medicine in the orange box. And because you know what day of the week it is, because these are always labeled the same color, it will make it much easier for you, make it much safer for the person you're taking care of to just say, go take the medicine in the yellow box, red, orange, yellow, green, blue, purple, brown. Everybody's on the same page. We're not making mistakes. Boom! Another really important tip that I can give you is to make sure that you're taking this person out on fun outings. It's really easy to get wrapped up in all of the doctor's appointments and the physical therapy appointments and the occupational therapy appointments and the psychologist appointments. But if you are only taking your loved one out on doctor's appointments or things that are not so fun, they're going to start to correlate you with those not so fun things, and you will begin to correlate them with not so fun things. And it's easy to forget the lightheartedness and the fun that the two of you could and have probably had together. So if you are able to, please try to take them out for something as simple as ice cream, or take them on a walk, something that does not involve going to the doctor or going to an appointment. When you do go out of the house, it's really important to pack a bag that includes all of the things that they will need in case of emergency or just simple things to make life easier. You're going to want to make sure you remember all of the afternoon medication, all of the morning medication whenever you're leaving. If you by chance take longer than you expect, make sure that you have all of the medication that you need for that person. This includes things like insulin, a glucometer, anything it is that involves their health care. You're gonna wanna make sure that you have those things packed. Also make sure that you have an extra change of clothes, extra underwear. If they wear briefs, make sure that you pack those, and pack wipes, not only for their hands, but also for any accidents that might happen along the way. When I worked in home care, I specifically like to let that person know that, hey, if by chance you need it, in the bag, I have an extra brief. That way, when they go to the bathroom, they can take the bag with them. They can clean themselves up if they need to. They don't need to embarrass themselves by making it an event, by telling you, hey, I had an accident. They know that everything they need is in the bag and they can take care of themselves if they need to. One of the hardest things to talk about is end of life care and DNR, DNI, do not resuscitate, do not intubate. What is that person's wishes? This is really important if that person has some sort of event, or if they are going to the hospital and something happens. It's really important that you know what that person's wishes are. It might be really difficult for you to have that conversation, and I can give you some prompts and questions to ask on how to make this conversation a little bit easier. I might actually make that a totally separate video because it is really a hard conversation to have with somebody, but it's so important that you know what that person wants. I cannot stress enough, it is important to be CPR certified. You should be doing this whether or not you're caring for an elderly person or not. Get CPR certified so you can help those in need if something happens around you. Have a list of medications ready and available should something happen, or while you are at the pharmacy, if there are any questions, you know exactly what that person is taking. So when you go to the pharmacy, you help pick up medication. They might say, oh, this drug that you're picking up, this newly prescribed drug, do you know that has a drug reaction with such and such medication? Is the person currently on this? You're not gonna know unless you have the list of medications. So make sure you pack the list of medications. It's really important to use one health system if possible. So locally, this might mean if you are seen with cardiology, but you're also seen with pulmonary, it's really important that that person sticks with one health system so the right hand knows what the left hand is doing. If at all possible, try to stick with one healthcare center. This might mean for our local area, don't go to Hershey, Lancaster General, and Pinnacle. Try to pick one healthcare system and stick with it, if at all possible. I'm not saying don't get second opinions or don't go outside that health system if something better is available, but if you are able to stick with one healthcare system, do so. That way, all parties know what measures are being taken to take care of this person. If at all possible, try to schedule doctor's appointments in clusters. So if you're heading to, let's say in my instance, Hershey for a pulmonary appointment, try to schedule the cardiology appointment for an hour or two later. That way you're not making more than one trip. You're able to take care of all things at one time. You have in your head what was taken care of with pulmonary today. When cardiology asks questions, you have that information on hand. Just makes everything a little bit easier and simpler. And I really want to finish off here by reiterating something that I already talked about, but I want to talk about it in various capacities. Please give this person as much control as possible. I can't stress to you enough what it means to somebody to give them the gift of autonomy. Allow them to decide what is happening and when it is happening. And last but not least, if you are carrying around a multitude of emotions, guilt, fear, anger, all of that is normal. It is so normal for you to want to take care of somebody, but also be irritated about having to care for that person. I don't care who you are, that is normal, and don't let anybody ever tell you that it's not. I can't stress enough how important it is to take care of yourself. You will get burnt out and you will no longer want to care for that person. So please, please, please take care of yourself. Go to counseling, get a therapist if you need one, find yourself a support group, a good friend that you can vent to, anything it is that you feel that you need to be a better, whole, more fulfilled person. Get yourself some relief, find an outlet for you to vent, get rid of some of the irritation, the anger, and help fill and fuel your tank so you can better care for that person. If you have any questions for me, please leave them down below. I have a lot more that I could give you, but this video is getting pretty long. Maybe I'll come out with a part 2. I love you guys, and I will talk to you soon. Bye!